Good morning, good morning. Good morning and welcome to this year's pre-registration exam workshop. This workshop is purely intended to assist you get ready for the upcoming examinations so that you meet all the requirements of internship. Just a few rules as we go along. You can ask all your questions via the Q&A function here on Teams, or you can use the comment section on YouTube. The session should take approximately 3 hours. Please do stay up until the end. This is so that you don't miss anything. And trust you me, what you will get today is quite important for the day of the examination so that you have a seamless experience with the examination. And towards the end of the workshop, we will ask you to then fill in a survey. The survey is so that we know what to improve for the upcoming presentations. The presentation slide. So on the So please do participate, ask all your questions. We have the examiners, the moderators, and the team to assist you in any question that you might have. All right. So how we are going to go is we will have the introductions and the welcomings by myself. Then we're going to have Prof. Demana take us through the calculation part of it. We will have a 10-minute leg stretch or break for you to get your refilled your coffee, your water, and then we're going to come straight back and we're going to have Mrs. Khan take us through the general section of the paper. And then from then on, we will come back and we will look at the actual examination setup as to how to log into the examination. Your questions will be answered as we go along via the Q&A function, but then we will also have a section where we wrap up all your questions and provide a summary of all your answers. So you have a picture of who is here. You have myself, Elizabeth Gumede, as one of the managers from pre-registration who will be facilitating the workshop. And then you have Prof. Patrick Demana, who is our moderator, and he will be guiding you through the preparation for the calculation section. You have Mrs. Razia Khan, who will take you through the general section, also giving you tips on how to prepare for that. We have another moderator on the call as well, Dr. Diane Johnston, who will also be assisting, especially with the Q&A part towards the end, to make sure that whatever question you have, whether it's regarding the content of the examination or the setup of the examination, are answered and you are ready for the examination. The unit of pre-registration, which is where you are currently registered as an intern, is led by Mrs. Malaku, who is our senior manager, and then most of your queries will be attended to by myself, Ms. Lisbeth Gumede. So when we look at the actual examination itself, right, it is an entire paper that has 120 questions, right? So it is one paper. When you are assessed over one paper, which has 120 questions. However, to aid in you writing better, the paper is split into two. Right? So we separated the general question from the calculation, and that is why you write in 2 days. It is very important for you to understand that you must pass both sections in order for you to pass the paper. So day one, you write the calculation section, which has 40 questions over 2 hours, and the sub minimum for that one is 60%. So as much as the overall pass for the paper, which is one paper, right? Remember, is 50%. The two sections have sub minimums. Calculation sub minimum is 60%. General sub minimum is 50%. So day one, you write the calculation for the questions over 2 hours. Day two, you write the general paper, which is 80 questions over 2.5 hours. So how this then works out to is you have give or take 2 minutes per question. It is very time sensitive. So you must make sure that as much as it is an open book exam, you are prepared enough for you to look for your answers, get to your answers within the time frame. I will now straight hand over to Prof. Demana for him to then take you through the calculation section. He will go through the domains with you and a few calculation examples. Please pay attention, have your notebook ready and ask your questions, and then also make sure that whatever other questions you have, whether it is an example that is unclear, you put it in the Q&A function or you put it on the comment section on YouTube for it to then be clarified to you right now. All right, let's then go straight to the calculation session. Do enjoy. Thank you.
Thank you very much, Ms. Gumede, and good morning, everyone. Good morning, colleagues. I will be sharing the slides where I'm going to start. Can you see my slides? Can you confirm, Ms. Gumede?
Yes, we can.
Thank you very much. Once again, good morning, everyone. I will be guiding everyone in terms of the calculation section. There are 40 questions regarding calculations, and the sub minimum is 60%. And this means that 24 out of 40 questions, you need to pass those in order to be deemed passing the calculation exam section. And the time allocated for the calculation exam paper is 2 hours. This means that for 40 questions within 120 minutes, each question is approximately 3 minutes. And interns must answer, as I've indicated, 24 out of 40 questions correctly. Sub-minimum of 60% applies independently. And it must be met regardless of overall exam performance. The 40 questions are drawn across various sectors: manufacturing, wholesale, community, and hospital. I'm trying to move to the next slide. And the various domains will cover questions that you are expected to practice. In terms of domain 1 and domain 4, you will recall domain 1 is on public health, and domain 4 is organization and management skills, but there are various competency standards regarding that. Domain 1, competency standard 1.4 is health economics. So you need to be familiar with calculations regarding these competency standards. And that's basically about cost analysis, the pharmacoeconomics examples, cost effectiveness analysis, cost minimization analysis, cost differential between a therapeutic agent, and the cost differences between the branded and generic equivalents and so forth. And in terms of domain 4 is financial management, those that deals with budgeting, percentage markup, and dispensing fee. We have indicated here that there are smaller domains, not because they are not important, as I've indicated that domain 1 public health and domain 4 organization and management skills, very important, but there are few questions from these domains. Domain 1, roughly 4 questions, and domain 4, roughly 2 questions. This is very important for you when you prepare for the exam paper, because you don't want to spend lots of time preparing for this. You have got 40 questions. It's within 2 hours, and relatively in terms for these domains, there are only 6 questions. In terms of domain 2, which deals with patient care and medicines management. And you will recall that this domain 2 is for safe and rational use of medicines and medical devices. Relatively, it carries lot of questions. It's 11 questions as compared to domain 1 and domain 4. And the calculation types that you need to prepare for that include dose adjustment, pharmacokinetics, creatinine clearance, and there are those which deals with isotonicity, concentrations, dilutions, reconstitution of dry powders to appropriate concentration, calculation of BMI and peak flow reading. With regard to domain 3, that's where majority of questions come from. And there are 5 competency standards, roughly 23 questions, which is 58% of the calculations. And the competency standards include medicine production, and you can see type of calculations that you need to prepare for. Those that deals with concentrations again, and concentration, we talk about percentage weight per volume, percentage weight per weight, percentage volume per volume, density calculations, dilutions, again in terms of isotonicity calculations, molecular weight, triturations, and so forth. In terms of competency standard 3.2, which is supply chain management, you need to be familiar with calculations that deals with percentage markup, acquisition costs, lead time, safety levels, batch supply cost analysis. And in terms of competency standard 3.3, formulary development, calculations that deals with cost, ABC analysis, cost benefit analysis, and so forth. With regard to competency standard 3.4, medicine dispensing, prescription verifications, amount of medication required for a prescription, dosage, suitability of doses by weight and surface area, and again concentrations, and competency standard 3.5, medicine compounding, and that deals with master formula, changing concentrations, solubility, dilutions. So there is an overlap in terms of these calculations. Competency standard 3.4 and competency standard 3.5 overlap with domain 2. Examples, dilutions, reconstitutions, etc. So just to give you some few tips for you to prepare very well so that you will be competent with regard to calculations. It is very important that you are familiar with the units. Always identify the SI units involved, and conversion is very important. What are the SI units for this quantity? Do units on both sides of the equation match? And just to emphasize as well in terms of the units, are the units relevant in the South African context? We don't use the pound as a unit. And therefore, when you practice, it is very important that you take note of that. I can't emphasize more in terms of the equation. Identify the equations used while practicing. And you should build your own reference list, recognizing which equation applies. Example, dilution formula, C1V1 equals to C2V2. It's not only to know the formula, but more importantly, how to apply that formula. Write down your working clearly. Even if your final answer is wrong, a logical method shows understanding and helps you catch errors. And be aware of time all the time. So I'm just going over some few questions that were prepared for you so that you can see what type of calculations, as I've indicated before, you can come across. I would like you to try answering this question before proceeding to the next slide. As I've indicated, you have 40 questions within 2 hours, and each question roughly is about 3 minutes. So this is a question on domain 1, cost comparison. A 55-year-old male patient is stabilized on warfarin 5 milligram daily at a cost of 28 rand 0.80 cents per month. The patient has his INR monitored weekly at a cost of 117 rand 0.70 cents per test. The patient has heard about rivaroxaban from his doctor and wants to know the cost implications. The cost of rivaroxaban 15 milligram daily is 637.95 cents per month. What is the difference in cost annually between these two options? And there's a hint. Warfarin requires both medication and monitoring costs. Rivaroxaban costs are medication only, no INR monitoring needed. So you can try within few minutes and see if you can be able to answer this question. You can go to the answer to this question. You need to calculate for warfarin 5 milligram daily. You were told that the medication cost is 28 rand 0.80 cents per month. Therefore, you need to calculate for 12 months. That is per annum. The cost for INR is 117 rand 0.70 cents per test. And therefore, a year annually, there are 52 weeks, because you were told that it is 117 rand 0.70 per week. Therefore, for 52 weeks, you need to calculate that in order to get it per year. So that means that the total cost is for the INR monitoring plus the cost of medication. That gives you a total of 6,465.40. That is the annual cost. Then for rivaroxaban 15 milligram daily, the cost, you were told that it is 637.95 per month. And therefore, you need to calculate for 12 months annually. And that should give you a total of 7,655.40. So there's no need for you to do a separate calculation for INR monitoring test, and also in terms of a weekly monitoring, because that has already been calculated. And the difference for rivaroxaban compared to warfarin will be 7,644.40, and then you will subtract 6,465.40, and you will get a difference of 1,190 rand more per year in terms of rivaroxaban. So that is how you would have done this calculation. If I move on to the next calculation, a patient requires an intravenous infusion of 0.9% with per volume sodium chloride. In a hospital pharmacy department, you have water for injection BP and 4.5% with per volume sodium chloride solution BP. Assuming no volume displacement effects, what volume of the 4.5% with per volume sodium chloride solution BP needs to be added aseptically to an expandable PVC infusion bag containing 100 ml water for injection BP to produce the required sodium chloride concentration? Again, I'm giving you a few minutes. Try to work out the answer before proceeding. The next question. Okay, we can go to the answer to this question. I just want before we go to the answer, just to indicate to you that there are different ways of answering this question. You have water for injection. Obviously, there's no sodium chloride there, which means that is 0% sodium chloride present in terms of water for injection. You have a highly concentrated sodium chloride, which is 4.5%. So you have got a concentrated higher strength. You've got water for injection, and you need to mix these two in order to end up with 0.9% weight per volume. So that means that you can use a dilution formula because we are diluting with water from a higher strength to a lower strength. But another way of dealing with this question is to use alligation. Alligation, you use it when you have got diluents, like in this case, water for injection is diluent, and diluents have 0% concentration of the active because you don't have any active. Alligation, you use it even when you have only active without anything. If it was just sodium chloride as a salt, it's an active, and actives have 100% because they don't have a base, it's just pure active. For alligation, you use it when you have got different types of concentration. Looking into the two different ways of working this, if you have practiced sufficiently, you can easily do this with alligation. You'll have 4.5%, you'll have 0%. In the middle, you want 0.9%, and then you do the parts. Then you do calculation, you will end up with the correct answer. If you choose dilution, normally dilution, the formula is C1, V1 equals to C2, V2. Normally, you will only have one unknown quantity or parameter. Either it is C1 or it is V1 or it is C2 or V2. Here you have you have a C1, which is 4.5% with per volume. You don't know V1 because that is what you are calculated to. You are requested to calculate. C2, you know, is 0.9%. But V2, you also don't know. Because what you are given is the 100 ml only of water for injection. So between the two methods, to me, the easiest would have been alligation because there's a little bit of a trick on this one. Because you are going to ask yourself, but V2 is not 100 ml because that 100 ml needs to be mixed with a certain amount of V1, which is the 4.5%. So how am I going to calculate that? So using dilution formula, C1 is 4.5, C2 is 0.9, V2 is 100, but V2 is 100 plus V1 because you need a certain amount of the 4.5% in order to mix with 100 ml so that you end up with 0.9%. And therefore, if you do the calculation, you will end up with 25 mil. If you do by allegation, very simple also, you will end up straight with 25 mil. So the point for this question is be familiar and practice dilution, allegation as an example. You'll be able to pick up straight away that this is dilution. And normally, as I've said, you're given one unknown quantity, especially with if you want to use dilution. Then if it's allegation, again, just to recap very easily, if you've got diluents or basis that has this is 0% concentration, active 100%, then when you have got different types of concentration, you can use allegation. Example, mix 10% of ethanol with 15% of ethanol and 22% of ethanol. What is the final concentration? Or if it's two different types of ointments, one is 17%, one is 12%, and then you want to get the final concentration when you mix that. So you should be familiar with both allegation and dilution. So just to move on to another type of calculation, molecular weight, that's domain 3. Question is, given that the relative molecular mass of sodium chloride is 58.5 gram per mole, what amount of sodium chloride powder is required to prepare 300 ml of a solution containing 50 millimole per liter? So I will give you a few minutes for you to try to get to the answer. Just a tip as well, in that some questions will relatively be very easier. You will finish them within a minute, within 2 minutes or so. And therefore, you should maximize that time that you have, so that the questions that may appear a little bit challenging, at least you will have more time. So just few minutes for this one. Is a relatively easy question, given that the relative molecular mass of sodium chloride is 58.5 gram per mole. What amount of sodium chloride powder is required to prepare 300 ml of a solution containing 50 millimole per liter? So basically, in terms of the answer, you need to be familiar with the formula for molecular weight. Number of moles equals to mass divided by molecular weight. And if you have that as a formula, you should easily be able to work it out, because you are given molecular weight, you are given volume, you are given concentration. You need to calculate mass, And you can calculate the total millimoles, and you convert that millimoles to moles. Hence, I emphasize the issue of units in the beginning and the conversion thereof that you need to familiar yourself with in order to convert from millimoles to mole, or the other way around, how you go about that. And if you do your calculation, you will end up with 0.8775 grams, which is the same as 877.5 milligram. So the important part here is be aware of the formula regarding molecular weight. Now moving on to different type of calculations, and this is isotonicity. And here the question is, a pharmacist receives the following prescription: ephedrine hydrochloride 0.5 gram, chlorobutanol 0.25 gram. You need to add dextrose anhydrous in order to make the solution isotonic. And the amount of purified water to be added to make that solution is 50 ml. So the question is, how many grams of anhydrous dextrose should be used in compounding the prescription to make an isotonic solution, given that the sodium chloride equivalent for ephedrine hydrochloride 1% weight per volume is 0.30, chlorobutanol 1% weight per volume is 0.24, anhydrous dextrose 1% is 0.18. So you are given that information in terms of the sodium chloride equivalent. And how do you make this solution isotonic? By adding dextrose anhydrous. So I'm giving you a few minutes again just to try and see if you'll be able to come up with the right answer. So if we go to the answer, what the question is testing you is for you, if you know the formula for isotonic, for the calculation of isotonic solutions using the sodium chloride equivalent. There are different methods. There are freezing point depression method in order to make solution isotonic, or you can use the sodium chloride equivalent method to make solution isotonic. And the only way you'll be able to know this is if you know the formula. If you don't use the formula, I don't know if you'll be able to devise yours in the exam paper, but you really need to be familiar, to practice, and know that if a question comes regarding on isotonicity calculations, you'll just be able to apply that. And the formula for the sodium chloride equivalent method is referenced to saline. An isotonic solution is equivalent to 0.9% sodium chloride in 100 ml. So either you use this in terms of percentage weight per volume, that is in gram per 100 ml, or you use it in terms of gram per liter. It doesn't matter if you use it in terms of gram per liter, it will be 9, and if you use it in terms of percentage weight per volume, that will be 0.9. But you will need to subtract the sodium chloride equivalent contributed by each ingredient, and the formula will indicate for sodium chloride equivalent is the concentration, as I've said, either in gram per 100 ml, that is percentage weight per volume, times by the equivalent value of that ingredient. Or if you use gram per liter, it will be the concentration in gram per liter times by the sodium chloride equivalent. And when you have that, then you need to subtract that from 0.9 if it's in percentage weight per volume, or 9 if it is in gram per liter. Doesn't really matter. And then once you have that, you just need to use the sodium chloride equivalent for dextrose in order to find out the amount needed. So very simple, sodium chloride needed for isotonic solutions, 50 ml. But what we have is that is 0.9 gram. That is in 150 ml, we'll have 0.45 gram. And then for ephedrine hydrochloride, you will end up with that amount. And for chlorobutanol, you will end up with 0.12 gram. And then you take the total amount. What is there? There's just a mistake in terms of deficit. It needs to be, instead of 0.45, it needs to be 0.9, because that's the formula that you actually use. And then you will subtract that total. Then you will end up with the amount of 4.8 gram if it is 1,000 ml. But in terms of 50 ml, it will end up with 0.24 gram. So the actual amount that you will end up should be 1.33. So there's just a mistake. It's not 0.167 gram or equivalent 167 milligram. Is 1.33 1,333 gram, 1.33 gram for that. So it's just everything is fine except that just where it says deficit 0.45. If you use weight per volume, it needs to be 0.9 in terms of that. And then the final answer should be 1.33 grams. So in terms of isotonic solutions, the freezing point depression, calculate the quantity of sodium chloride that should be added to 150 ml of a 1% weight per volume solution of amorphine hydrochloride to render the solution isotonic with blood plasma. Here you are given the freezing point depression solution of apomorphine hydrochloride is 0.08 degrees Celsius, and the freezing point depression of a 1% weight per volume sodium chloride is 0.58. So you are required to calculate the quantity of sodium chloride that should make 150 ml of 1% weight per volume isotonic with blood plasma. That is solution of apomorphine hydrochloride. Again, I'll give you a few minutes. So the question is simple in terms of calculation. Honestly, it's a question of just using the freezing point depression formula in order to calculate this. And if you have prepared well, you should be able to do this calculation very easy. The formula for freezing point depression is 0.52 minus A over B. As I've indicated earlier on, it's not enough only to know the formula, but how to apply it. In other words, even if you know the formula is 0.52 minus A over B, you need to know what A stands for, what B stands for you to be able to calculate. Everything is referenced to 0.52 because the blood plasma freezes at minus 0.52 degrees Celsius. So if you use that formula, freezing point depression 0.52 minus A over B, where A is the concentration that you have in percentage weight per volume, and it's easy. Here you are already given 1. It's already in weight per volume. So that means the concentration is 1, and then you multiply by the freezing point depression of what you have, which is apomorphine hydrochloride. That is A. B should be, I said 0.52 minus A over B. Then B is the freezing point depression of the substance you want to adjust your solution with. You want to make this solution isotonic by adding sodium chloride. That means B will be the freezing point depression of sodium chloride. And plus everything is in percentage weight per volume. Oh, I think there was just a mix up. If you recall, for this calculation, it was supposed to be for sodium chloride. I apologize for that. So the memo for this one is the one for sodium chloride equivalent here. Just my apology. And you will recall that I indicated that you need to subtract 0.9. So this is the correct one. For that one, 0.9 minus 0.42, I said 0.48. Then you just divide by that, you end up with 1.333 gram. So my apology, this was supposed to be, this slide was supposed to be deleted for this, because the answer is this using sodium chloride equivalent for the other one. And for the one for freezing point depression, it was supposed to be on this slide, my apology, but that is very easy. So it's 0.52 minus A over B. A should be 1. Then you multiply by the freezing point depression for the apomorphine. That will be 1 times 0.08. Then divide by, I've indicated B as a freezing point depression of substance you want to adjust with, which is sodium chloride. That is 0.58. Then it will be 0.52 minus 0.08 divided by 0.58. Then you will end up, if you have your calculator, with 0.7586 gram. But that 0.7586 gram is per 100 mil, because that is in percentage weight per volume. And the question asks for 150 mil instead of 100 mil. So you are going to say 0.7586 gram per 100 mil, therefore X in 150 mil. Then you should end up with a value of 1.137 gram for that. My apology for mix up on that. So the next question is milliequivalence. How many milliequivalents of potassium ion are there in a 250 milligram penicillin V potassium tablet? How many milliequivalents of potassium ion are there in a 250 milligram penicillin V potassium tablet? You are given molecular weight of penicillin V potassium, which is 388.48 gram per mole. So the question is asking you if you know how to calculate milliequivalence, and you should therefore have the formula for milliequivalence. You should know the formula for milliequivalence. So I'll give you a few minutes on that. It's a simple question as well, if you know the formula. So let's see what type of answer you came up with. So in terms of for the formula for milliequivalence, equivalence equals to valency times moles. Very simple question. You need to know how to calculate number of moles, and once you get number of moles, you just need to know how to convert from moles to millimoles or vice versa. The valence of potassium is 1. And as I've said, the formula for equivalency is equivalence equals to valency times moles. So you already have 1 because the valency for potassium is 1. 1 times number of moles. Number of moles, you know the formula as I've indicated. We have done 1 previously. Number of moles equals to mass divided by molecular weight. You are given the mass is in milligram. Number of moles is in gram per mole, so you will need to convert that mass from 250 milligram to grams, which is 0.25. You divide that by molecular weight, then you will end up with number of moles. Convert that to millimoles. You will multiply by 1000 from moles to millimoles. and then you just substitute that value, you end up with the answer. So molecular weight 3.88.48, valency is 1. You've got the formula, and then you just substitute. You should end up with 0.64 milli equivalents regarding that. So it's a question of just substituting the values in terms of what you are given to the formula, as I've indicated. Then another question, that's domain 4, regarding costs. A new vitamin is on promotion for 42 rand 0.01 cents per pack. However, the pharmacy qualifies for a 6+2 deal. What is the cost per pack if the pharmacy takes advantage of this deal? So I'll give you a few minutes, and we are almost there with all calculations. A new vitamin is on promotion for 42 rand 0.01 cents per pack. However, the pharmacy qualifies for a 6+2 deal. What is the cost per pack if the pharmacy takes advantage of this deal? I think we can answer for this question. A 6+2 deal means you pay for 6 but receiving 8, and therefore first calculate the total amount paid for 6 packs at 42 rand 0.01 cent each, and then divide the total cost paid by the total number of packs received to get the effective cost per pack. So step 1, understand the deal. As I've just indicated, you pay for 6, you get 2 free, and then calculate the total amount for 6 packs, which is that. Then you divide by 8, and you can see that the amount is 31 rand 51 per pack, which is a saving of 10 rand 5 per pack by taking the 6+2 deal. So basically it's a 25% discount in terms of that. So we go to the last question for today, for this session. A 60-year-old male patient who weighs 75 kilograms is administered a gentamicin injection. His last plasma creatinine was measured as 300 micromole per liter. The doctor prescribed 350 milligrams of gentamicin to be administered IV. Is this dose correct? So try to work out this calculation, which deals with dose verification. So I'll give you 3 minutes for this type of calculation. So in terms of the answer to this question, you should ask yourself, what type of formula, what type of equation should I use that incorporate age, that incorporate weight, that incorporate plasma creatinine? And if you have the formula handy, it will be a very simple question, a very simple calculation to deal with. So the formula for you to use is the Cockcroft-Gault formula, the Cockcroft-Gault equation, because that is the equation that incorporate age, weight, and plasma creatinine. And the formula is 140 minus age multiplied by weight divided by plasma creatinine and multiply by 0.814. And all you will need to do basically is to substitute. And when you substitute, you will get the creatinine clearance. And then you just need to look in terms of table that talks about dosing depending on the creatinine clearance. And in terms of the clearance, 80 to 70 ml per mil, you need to dose 5 milligram per kilogram once daily. If it is in the range between 10 to 30 ml per mil, the dose that will be needed is 3 milligram per kilogram once daily. And if it's less than 10 ml per mil, it will be 2 milligram per kilogram every 48 hours. Then you will decide whether the dose is correct or not. So step one, as I've said, you must just know the formula that incorporates age, weight, and creatinine. And here it is, you substitute. You were told that the age 60-year-old and weight is 75 kilogram, and then you substitute, you get that 24.6 mil per mil. Then all you need to do is look in terms of dosing, what is really required in terms of the creatinine clearance volume. If it's between 30 and 70, 5 milligram per kilogram, in the range 10 to 30, 3 milligram per kilogram once daily, and less than 10 mil per mil, it's like that. Then the answer you got was 24.6 mil per mil. Then you look where it falls. 24.6 does not fall between 30 and 70, but it falls between 10 and 80. Doesn't fall in terms of less than 10 mil per mil. And therefore 24.6 mil, the dose that is actually needed is 3 milligram per kilogram. And the patient weighs 75, and then you just multiply that, you'll get the correct dose, therefore is 225 milligram. So that means for this patient, there was an overdose by 125 milligram because the doctor has prescribed 350. And therefore, the dose was not correct. The actual correct dose is 225 milligram. So that is the end of the calculation. Apart from that, we need to give you some tips with regard to textbooks for you to prepare. The books that we recommend in terms of calculations is the book called Pharmaceutical Practice, 4th edition. I think that is the latest. That is by Winfield, Rees and Smith. There's also another book which is very useful for you to practice and get this formula. Calculations of Pharmaceutical Practice, again by Winfield. That's another book. There's also a book called Pharmaceutical Calculations by Howard C. Ansel. A very, very useful book. I've indicated when I started presentation for calculations that check the units when you do your preparations. Are these the SI units? Are the units used in the South African context? And indicated that as an example, we don't use pounds in terms of weights. And all the best. So we have relatively, as a summary, posed some challenging questions regarding calculations, isotonicity, because we have seen that interns struggle somewhat, or maybe they don't practice that much, but they are really simple if you really know the formula, the sodium chloride equivalent, freezing point, depression, and you just substitute whatever you are given, the molecular weight, milli equivalents, just know the formula again. In terms of for doses, we gave you the Cockcroft Gold equation as an example. And then there were questions based on dilution slash alligation, as we've done, and also in terms of the cost as well. And we've given you tips in terms of where the majority out of 40 questions will come from, so that when you practice, you will practice along those tips that we have given you, and and you will be competent and successful regarding that. Thank you, Ms. Gumed. Thank you very much, colleagues and everyone.
Thank you very much, Prof. Dimana. We are now going to take any questions if there are. Otherwise, we can then go on our 10-minute break. Please type your question on the Q&A section or on the comment section of YouTube. All right. We're going to give you time to think about it and load your questions. Please load your questions while we go on our 10-minute break. It's now 10:23. Let's make it a 7-minute break so that we are able to continue and finish on time. Let's all be back by 10:30. Thank you very much. Please type your questions in the interim. It is exactly 10:30, and I see we had a few questions. Let's try and address a few of them while we wait for to start the second session. Right. So the first question that we have is, do we need to register for the practice exam? And if so, when do we register for it? So we will talk about the practice exam in a few minutes. However, yes, you need to book for it and communicate, and the bookings will open on Monday. Communication regarding that will follow very soon. Let's see what the next question was. In the calculation exam, will the formulas be given and other information like valencies, molecular weight of drugs be given? So you can bring a formula sheet with you because we will not be able to give you a formula sheet. However, some of the questions will have the molecular weight of the drug in them. Next question, do we have to round off to 1 decimal for our answers? Not necessarily 1 decimal. So with this one, you need to look at your options given. So if your options have 2 decimal places, then you need to round off to that. If they have 1 decimal place, you need to round off to that. So just make sure that you are looking at your answer options and then follow the guideline provided there. Formula sheet, yes, you can bring a formula sheet. Is the practice exam on the 2nd or the 3rd of June? The practice exam is going to be on the Tuesday, which is the 2nd of June. Do we have it? The last question we're going to take before moving on. Is it true that depending on the sector of pharmacy in which you are doing your internship, you write a different exam? The answer is no. The exam is the same for all registered interns. It covers all sectors of pharmacy. So it doesn't matter which sector you are. That's why when you book, there's no selection of sector. It's the same paper written on the same day for all interns. It's just that the questions are randomized. All right, let's pause there with our questions and continue with the workshop. Please do continue posing your other questions. We will continue with them as soon as we are done with the next session. Right now, we will move then on to where Mrs. Khan will now give you some guidelines on how to prepare for the general section of the examination. Mrs. Khan, over to you.
Thank you very much. Good morning, colleagues. Good morning, interns. Am I audible? Yes.
Yes, you are.
Okay, thank you very much. So we're going to move on to now the general section of the intern exam, of the pre-registration exam. And the general questions, there is a blueprint for these, and it comes from the various domains. So these are represented here graphically, and you can see from how it is structured that most of the questions then would be coming from domain 3, which is the safe and rational use of medicine. So when we look at domain 3 and what type of questions you can be expected to find in that domain, it relates directly to that competency. So it would be things like looking at promoting medicines according to the GXP, supply chain management, formulary development, medicine dispensing, compounding of medicine, medicine disposal and destruction. And then the second most number of questions comes from the professional and personal practice domain, and the third one from public health. So with these ones, again, we're looking at patient-centered care, you're looking at leadership, decision-making, all the competencies that come in your intern manual under those specific domains. In public health, mainly looking at how we promote community health and wellness, what information we give to the public regarding medicines, looking at the economics of health and primary health care. So you can expect when you look at these competencies, the questions related to these coming from these specific sections. And then fewer questions from the other domains, domains 3, 4, and 6, but really not to be disregarded. Okay, so remember that this is to check your overall competence as a pharmacist, and this is where the questions will mainly come from and mainly be related to. Next slide, please. So then, yes, where do we get all this information? So we know you have embedded knowledge, okay? So you've learned a lot already. So your instinctive reaction is to refer to your embedded knowledge, but there are several references that you can use, and please do use them. So there are physical copies that you could have of textbooks, study notes, for example, and then you could refer to PDF references on the exam site, which we'll show you later, as well as references to the legislation and any textbooks that you might have downloaded, as well as permitted websites online, which we'll also go into just now. What's important to note is, are these references current? Okay, so rely on the most recent references, and is it relevant to the South African setting? So when we want to refer to a textbook, for example, or any physical copies, is it the most recent copy, and is it relevant to how we practice here in our country? Okay, next slide, please. So where else can you find information? So you would have by now downloaded your intern and tutor manual. So if you go onto the SAPC website and you log in and you go to the pharmacist intern section, and the section under manual, which is in red here on the slide, you'll go there and download the intern and tutor manual, which I'm sure you've already done. Then, in order to then assist you with the how to complete things like your CPDs, you can go and download the CPD manual, which also has the important documents that you can use as electronic references. So these include your GPP, your essay guide to the GMP, basically all the ones that are listed here, all your STGs, your EML, and the National Drug Policy. Next slide, please. So on the website again, if you go to the icon, if you look on the top right-hand corner of the slide, the icon, that's a little book, and it will lead you to the publications. And in the publications, there's these various icons which take you to the annual reports, legislation, pharmacia, etc. And if you look under the legislation and pharmacia, you'll find additional electronic references. Next slide, please. So here, if you go under publications again, and if you're now under the tab of the legislation, you'll see that there are various regulations. So it's important for you to download these, okay? So try to download them before you start so that you have all these ready. Next slide, please. Again, then under legislation, if you go to the rules, you'll see the various rules on the website, and you can also download these. Similarly, then under legislation under the board notices, all the various board notices up to the most recent board notices will be found here. Next slide, please. So how do we then use the reference material? So when it comes to physical books, please do yourself a favor and familiarize yourself with these books, right? Where in the book will you find what information? Know how to use the books before the exam so that you know where to find the information you're looking for quickly, okay? Some tips when using books: having more books is not necessarily better. And avoid using a book that you haven't ever used before, or just think it's a good idea to bring along with you and then get stuck in trying to find out what the book does or what information the book contains on the day of the exam. And then also using your university notes may not always be the most current. Okay, so there might be changes, for example, to legislation. There might be different adverse reactions, for example, that might be picked up to medications since then. So you need to be able to use the most current information and not always rely on dated notes. Then when it comes to online, also again, familiarize yourself with the website. So go into the website, see how it works, see that you can navigate it easily, that you know where to look very quickly. Download all of these online references before the exam. It's really time consuming to search during the exam to not know where to go. So familiarize yourself with these. And then also just remember that the information may not always correlate to the recommended reference material. So it's important to start with the recommended material, okay, if you're unsure. If you know where to go, that's different. The next slide, please. So some of the other useful online resources that you can use, so these are over and above the online textbooks and the online board notices, rules and regulations that we've just covered that you can download from the council website. You can also then download the EM guidance app onto your desktop or laptop. There are other apps that you could use, for example, the MSD manual. You can also use the SAPRA website, the South African Pharmacy Council website, and these will all give you additional useful online resources. So can you use apps? You can use the app, but it must be downloaded onto your desktop. And also, can I use a second device for resources? So your second device that you may use is your phone, and that phone is not used. It's used basically for the examination process. So everything that you need must be downloaded before on your laptop. Okay, next slide, please. So here is a list of the reference materials that's in your manual. So if you go into your 2026 intern manual for the pre-reg exam, you'll see all these references have been listed, and these are the go-to references. So please remember to familiarize yourself with these. Some of the common ones are obviously the SAPC website. All the rules, regulations, board notices, and current information will be found there. And then some calculations text or reference that you can use. Then electronic copies of the acts, the Pharmacy Act, associated regulations, Medicines and Related Substances Act, and other relevant acts. And then have a comprehensive handbook on pharmacology. So the one that you're most used to using, use that one. Make sure that it's the current version. And then your SDGs, like I told you earlier. Also the Martindale, the Merck manual, and then the SAPRA website, the South African Medicines Formulary, also now is available online. Then the EM guidance, also online on your desktop. And then the drug supply chain management book and the drug interaction checker. So the rules and guidelines I've discussed, I think, in depth. You know where to find them. Also get the guidelines for good wholesaling and distribution practices and the GMP, as well as the GPP. Okay, next slide, please. Then we have electronic reference materials, and so these are available on the pre-registration exam platform, and these include your Good Pharmacy Practice Manual, your South African Guide to Good Manufacturing Practice, all the SDGs for all the levels of care, the National Drug Policy for South Africa, and your Martindale. So you will see a tab on the top right-hand corner, which will direct you to the references. So if you click on there, those are embedded. So you'd be able to use that information from there. Okay, next slide, please. So when we look at tips then, for how do I go about this paper and what will help me? Firstly, read the question carefully. Start at the very beginning. Identify the statements of which you are sure. So I know this. Identify what you know. And then confirm the references or statements. Whatever statement is in the question that you're unsure of, refer to the source documents, refer to the references that have been provided or that have been recommended for you to try to confirm what you're not sure about. And then if you cannot complete the question, carry on. And when you have time towards the end of the exam, come back to it. Okay, so if you find that you really are battling with a particular question, move on. So there are certain terms that are used in the questions, and this might help you also to try and identify that you look out for that. So look out for what the question asks. Like we said, read it carefully. If it says which of the following is true, look for the answer that's true. Which are false, look for the answer that's false from the list. So try to identify what those terms mean, like true and is and correct. false, not, and incorrect, basically all refer to the answer that from that you need to actually choose from the selection, the one that is not correct, or the one that is false, or the one that is incorrect. So when reading the questions, make sure that you read the question carefully. So when you read the options that are provided, in your mind you already know, here I'm looking for the one that is true, or in this question I'm looking for the one that is not true, and then start reading the options, and then you will arrive at your answer. So when you look at a question and it says what is the most appropriate option, this implies that from the options that have been given, more than one answer may be possible. Okay, what you need to do is select the most inclusive answer. So the answer that's the most appropriate. So if you find that something is slightly appropriate, or you just avoid those and find the most appropriate option. Okay, next slide, please. So when we look at how we go about managing time, please maximize your time. You have 80 multiple choice questions which you need to complete in 150 minutes. So that gives you 2 minutes per question. So in those 2 minutes, you are going to read the question carefully. So the time taken to read the question is not a waste of time, because if you read it carefully, everything else falls into place. So you use those 2 minutes to read the question carefully, read the options, and then select your correct option. So there is no negative marking, right? So don't leave a question blank. Attempt the question with the answer that you think is most correct. Okay, next one. So when we look at the areas of concern, and this comes from previous examinations that have been held, and we find that there are specific areas or certain areas where interns do not perform well. So these areas are listed here, and it would be really good if you revise these topics, look at the relevant references that can assist you with answering these questions, and then be able to refer to them if you're unsure of what answer to select. So the areas of concern we found has been in the area of pharmacovigilance, and especially with regard to reporting of adverse drug reactions. How do you report the adverse reaction? Where do you report them? What reactions do you report? What's the mechanisms? So those kind of that kind of information that actually should be relatively, it should be very important for you to know as a pharmacist, right? So we know central to what we do is pharmacovigilance. So make sure that you understand what it is and how you go about reporting adverse drug reactions. Then we come to another area of concern, which is the actual adverse drug reactions of specific medicines. So know where you'll find that information, and really make yourself okay with the most common adverse drug reactions that we find with medicines. And then for the not so common ones, be able to refer to those very quickly. Then it comes to scheduling status. And scheduling status, part of legislation, part of what you should know as a pharmacist is what schedule a drug falls into. Okay, so understand that, because then you understand how the prescription works and how to go about referring to the question in terms of the schedule of the medicine that is being asked about. So particularly pay attention to your Schedule 6 medicines, and pay attention to the medicines that have specific requirements. So, for example, your specified Schedule 5 medicines, and then the other medicines know what schedule they fall into. So if you get a question, for example, relating to pharmacist-initiated therapy, you should know if the medication is a Schedule 1 or Schedule 2, and if it is in your scope of practice to be able to manage those medicines and how you manage them. So scheduling status is important. Then when you look at management and recording of Schedule 6 medicines, like I said, not only knowing what status is of the medicine, but also how do we go about managing these medicines. So and management involves various aspects, right? So there's how do we dispose of these medicines, how do we order them, how do we store them, how do we dispense them, what are the rules and regulations regarding the recording of everything that we do around Schedule 6 medicine. And again, very central to your practice as a pharmacist. So make sure you know this information. Then when it comes to good manufacturing practice, again, What other, apart from the GMP documents, the PICS documents, for example, that you can refer to, know where to go very quickly. So these are the areas of concern we found that interns generally do not fare so well with. So please focus on them and make sure that you are okay with these. Next slide, please. So now here we have some example questions that we want you to attempt. So if you can just scan the QR code, you'll be able to get to this question. So we're going to give you some time to go into the questions and answer them, after which we will discuss them. Okay, so you can scan the code now and you can start. Okay, so I think we've seen the responses coming through furiously. I think we can go through the general questions that were put up and let's see how everybody fared. Um, so the first question asked, which of the following reference sources would assist you in determining if aspirin is safe to use in a breastfeeding mother? And the options were, okay, sorry, let's just wait for that to load. Okay, there we go. So there's the responses that were given. So the options were professional information for aspirin, and that was the correct answer. And then some people selected option C, which was the BP, the British Pharmacopoeia. So the correct option was the professional information. Okay, for aspirin, that would be the leaflet, and you would be able to find that information. Okay, so again, remember we said the most appropriate answer. Okay, so go through the options carefully and select the most correct answer. So when we go to the next question, which asked about methotrexate. So here is a little bit of clinical information. And the question asked which of the following statements are true regarding methotrexate prescribed for rheumatoid arthritis. So we're going to look at how people fared in that question. And then we'll discuss the options. Okay, so when we see how people fared, and you can see now in this one that we've received varying responses to this answer, right? To this question, sorry. So the options then were live virus vaccine should be avoided. Nicotinic acid is required for rescue procedures. The medicine is safe to use in pregnancy, and the dose is taken as a single dose once a day. Sorry. So for methotrexate, we know it's an immunosuppressive agent, and when you give an immunosuppressive agent, the general recommendation then is to avoid live virus vaccines, okay? So live virus vaccine should be avoided is the correct option, and you can see most people got that correct. It's not nicotinic acid that's required, is folic acid, and then you cannot use it in pregnancy, and the dose is generally once a week. So you can see why the others were not the correct option. Okay, so we can move to the next question. And the next question then looked again here at how do we manage prescriptions, right? And in terms of scheduled substances, what do we do? So you have a patient coming in with a prescription for venlafaxine, and it's a repeat prescription. And when the patient comes in, they ask you to request half the dose, right? 75 instead of 150. And what will you do? So again, remember we said the problems we get comes from scheduling status, from how to manage prescriptions regarding schedule. So now let's look at the options, and let's look at the responses and see what people said. So some people said that they would dispense 75 milligram capsules as requested by the patient. Firstly, let's look at the correct one, which said consult the doctor before dispensing the medication. So 69 people agreed with that, and that's the correct option. So when we look at the others, remember this is a prescription for medicine, and that's prescribed by a doctor, and the patient cannot change to ask you to change the prescription without you consulting the doctor. So all of the other options then are incorrect because you cannot change what is on the prescription. You cannot advise the patient otherwise. So option D is wrong. You have to give the patient what was prescribed, and if the patient requests anything different, to consult the doctor. So you need to know why the patient wants to take a lower dose, consult with the doctor, and reach an agreement. Okay. The next question 4, looked at which of the following is the recommended storage conditions for tetanus toxoid vaccine in a pharmacy. So this is a knowledge question, and let's just see what people responded. So remember, we need to know how we store our vaccines. It's important, right? And so the correct option there was that you keep it in the refrigerator between 2 to 8 degrees, it's temperature between 2 to 8 degrees Celsius. So that's the correct answer, right? So the tetanus toxoid we do not freeze, and we do not keep at room temperature. So the other options were incorrect. Then we had a question on a child presenting with a fever and a rash at the clinic, and the child has measles, and which of the following would be the most appropriate advice to give to the mother? So again, look at the question asking for most appropriate advice. So we look through the options, and we'll now look at the responses that people gave for this question. And we can see that the most appropriate advice to give the mother was to isolate the child for at least 14 days. So avoid taking dairy products, administer vitamin C, and the fever persisting were not the most correct appropriate advice. Okay, the next question. So what is the minimum period that a prescription record must be kept in the pharmacy before it may be discarded? Again, you should just know this from your undergrad and from your practice as an intern. But we look at the responses now. So we can see here that the responses given, the most responses were for 5 years, which is the correct option, and then the other ones were incorrect. So we had some people saying 10 years, others saying 1 year and 3 years, but you need to keep the records for at least 5 years. Okay, so those were how people fared. So when we look at generally across the board, most people did select the most correct answer, apart from question 5, where we looked at how do we then go about what would be most important. So isolating the child would be most important because you want to prevent further infection. However, if you look at option D, if the fever persists after the 3rd day of the rash, if it's a very high fever, you would want the patient to actually visit the practitioner, the general practitioner. Isolation period, though, could be less than 7. It could be around 7 days. It depends on when the patient actually was diagnosed. So we also need to read the question carefully. We can move on to the next slide, please. Sorry, can we just go back to that last slide? I'm so sorry. I'm so sorry. The options, the responses slide, please. So when we look at this question 5, and when we look at I'm sorry, I just read 4 days for some reason. But isolate the child for at least 14 days. So the period of isolation, it really does depend on when the rash appeared, okay? So you could in this instance, select option D, which is if the fever persists after the 3rd day, contact the doctor. If it's a high fever, you would want the doctor to be to revisit the child's condition. But in terms of the isolation, so the total isolation of the child, usually when the child presents, the child would already have had a rash, okay? So generally they say that you incubate, the incubation period for the measles is 14 days, but the actual isolation period can differ, and the isolation period when the child is contagious is actually from before the rash appears to after the rash. Okay, so that's usually around 5 to 7 days after the rash appears. So I think for this question 5, the correct option is option D, where we say if the fever persists, then after the 3rd day of the rash, then you should contact the doctor. I apologize for that. I read 4 days. Okay, so we can then move on. if there are any questions regarding any of the presentation. So if you can just use the chat maybe, or just refer to whatever you may have had a problem with in the presentation, and then just let me know.
Thank you very much, Mrs. Presentation on the general section. We will keep an eye out for any questions on the chat. So please ask your questions on the Q&A function and also on YouTube so that you have access to both the examiners and the moderators while they are still here. They will remain with us until the end of the workshop. So please ask whatever question you might have. Mrs. Khan, thank you very much. While we wait for the questions, we will be continuing with the presentation, going straight to the second part of the presentation. So the first part was focusing on the content of the examination. We will now then move on to the actual examination layout. But please remember to ask whatever questions you might have on the content. Thank you. All right, so now that we're focusing on the actual examination layout, SAPC conducts 3 examinations a year, right? Each examination comes with a practice exam. The aim of the practice exam is to provide you with a simulation setup. So you get to see how the actual examination questions are and how you are going to write the examination and experience the invigilation process. We've already had the first one on the 27th of Jan with the actual exam in March. The next practice exam is on the 2nd of June. It's going to be a Tuesday. It's less than a month away. The bookings for that examination are going to open on Monday. Before examinations open, you will be sent through communication with instructions on how to book and how to select your venue. Then the actual exam will be on the 4th and the 5th of August. It's going to be Tuesday and a Wednesday. Tuesday is calculation, Wednesday is general. The next trial is going to be the 8th of September practice, actual exam 2021 October. Again, please make sure that you practice the exam. The practice examination is compulsory. You will not be able to book for the actual examination if you have not partaken in any practice exam. Who is eligible to write the actual exam? So there is no eligibility criteria for the practice exam. However, for the actual exam, if you've been an intern for 6 months, or you are on your 6 month of internship on the day of the examination, you must have submitted all 6 portfolio of evidence entries and been found competent in 3. You must have practiced the exam, and your tutor must have submitted 6 progress reports. If you are on your 9th month of internship on the day of the examination, so how the system is set up is it does calculations when you book. It will calculate to say, when you are writing the actual examination in August, which month of internship will you be on? Or if you're writing in October, which month of internship are you on? So if you're in your 9th month of internship on the day of examination, you must have completed and been found successful in all 6 portfolio of evidence, submitted 4 progress reports, and have also practiced for the examination. When we send the information regarding the booking, we will also give you the cut-off dates. So there's a cut-off date for writing the examination for free. Otherwise, you'll be charged a late booking fee. We will also communicate the fees for writing the examination for the 3rd try, because the first 2 tries are free. However, the 3rd try comes at a cost. All of this information will be included in the email that will be sent to you closer to booking time. We are showing you the deadlines for your portfolio of evidence entries because these are tied to how you may qualify for the exam. Remember, we said 6th month, you must have submitted all 3 and be found competent in 3. 9th month, you must have submitted all 6 and be found competent on all 6. So you need to make sure that you are up to date with your portfolio of evidence, that you meet the submission deadlines, the verification deadlines, so that your results are released in time for you to book, right? So the lines that are in orange, those are lines that are showing that you might be you need to trade carefully there, and that may result in you paying a fee for your booking, because then the results might be released at a time that will then make it a late booking fee for you when you're booking for your actual examination. Again, a reminder of the dates that we're going to be having the examination and the dates that may result in you paying a late booking fee if you now submit your portfolio of evidence and they get released on those dates. So now when you book for your examinations, usually the actual exam will be open for booking 6 weeks prior to the actual date of the examination, and you'll be given 2 weeks to book. Within that 2 weeks, you will then be able to book for free, and then the bookings will close. Then we will give you a grace period for like 2 weeks. Within that 2 weeks, you will then have to pay a fee for that examination. However, from 14 days from the day of the exam, you can't book for the exam anymore. So bookings open 6 weeks before. For 2 weeks, you can book for free. At 4 weeks, we close the booking. However, for 2 weeks, you can book at a fee. And then 2 weeks before the examination, which is 14 days, you cannot book at the examination anymore. When we communicate with you, we usually use either SMSs or emails or both. So please make sure that we have the correct updated cell phone on our platform and the correct updated email address. Please also update your profile picture. The profile picture comes in especially on the day of the examination for verification purposes. So try give us a nice clean head and shoulder photo. We know you have beautiful graduation photos, but that's a full picture, and it makes it a bit difficult for us to see your picture, your face. So if you could please go to the website and update your photo so that it's a head and shoulder photo, so that on the day of the examination, when we are proctoring you, we are also able to verify that the person who's writing is the person who is registered on our system, right? Like I said, color image, as recent as you can possibly give us, because we know that things can happen and your body can change. But if you give us at least 6 months, then we know that no major changes could have happened there. Head and shoulder for identification purposes. It should look something like this. Please go to your website and update your photo there, update all your contact details so that we're able to reach you. And also try avoid updating your personal details a week, a day or two before the examination. Give the system enough time to sync. So if you could please update them this week and try and make sure that everything is up to date, latest end of July. When you now have to go and book your examination, this will also be sent to you probably early Monday morning or even tomorrow to allow you to be able to book. You will then log into your secure site. Under your dashboard, there's going to be a tab written pre-registration examination. When you click on that tab, you will then be able to go to examination booking. When you click on the examination booking, it will then allow you to book. It will tell you which examination is open, and then you will book. It will give you the date that you are writing each paper, and then you'll be allowed to choose a venue that you would be writing your examination. Because the examination is online, you can write it at home, at any other place that you deem fit, but then now it must have enough network coverage. It must not be too loud, and the lighting must be perfect. You can come to the SAPC offices if you so wish. If you choose to come to the SAPC offices, we will provide you with the data and a laptop. You just have to bring in your cell phone. You can write at work. However, with writing at work, please try by all means to use your own network. So try to use data from your cell phone, because what we have seen is that the Wi-Fi at work usually has firewalls, which then prohibit you from accessing the exam. So if you want to write at work, that's fine, but please try and make sure that you have personal data that you can use on the day. You can use your cell phone as a hotspot to then avoid network issues with the firewalls at work. We've already gone through the different venues that you can choose. What do you need for the day of the examination? You need a functional laptop. So your laptop must have a webcam. And the webcam must be active on the day because we need to be able to see you throughout the examination. You need to have a smartphone, doesn't matter the brand, just a smartphone that has functional cameras. For the calculation day, you will also need a calculator. Remember, we said you can, it's an open book, so you can have a pen, paper, notebooks open, and you can also use online resources that you can then put on your screen. So make sure that whenever you're booking, what you consider is the place that I'm choosing to write my examination quiet enough? Will I have enough space for my laptop, my cell phone, and my references, right? You will try to keep as calm as possible. You will be able to communicate with the invigilators should you need any help. Download your references and keep them on the day. What you don't want to do is now be frantically trying to search for new references. Have a folder on your laptop that has all your references. You can have your references pre-opened before starting the examination. If you're going to be using physical references, you can have them already bookmarked. Just make sure that everything that you're going to use is stored in order so that you are saving time. If you're going to be using a calculator, please make it a calculator you're familiar with. Let's not be experimenting on the day. Also, you will not be able to use your cell phone as a calculator, right? So bring a calculator, bring a pen and paper for you to jot down whatever you need to be jotting down as you go. Like we said, 2 devices, not a third one, right? Either a laptop or a desktop plus 1 cell phone. And your laptop or desktop must have a webcam. You will need to have stable network. I cannot emphasize this enough. Test your network. Make sure that you have stable network wherever you are choosing to write. If you know that where you are working or where you are living, there's not enough network, please make a plan ahead of time. Like we've already said, the SAPC is an option for you to come and write. Whenever you're looking at the software for your laptop, it must be compatible to Google Chrome, Firefox, and Edge. Please make sure that you have all these 3 browsers downloaded before the day of the exam. The practice exam is also for you to be able to test your equipment, test your connectivity, and test your browsers. On day 1 of the examination, when you're writing your calculation, we advise that by 8 a.m. you are seated and ready to start with your connectivity. As much as the exam will start at 9, we give that hour for you to be able to log in, to test, to communicate with your invigilators so that by 9 everything starts. Then you'll be writing your exam from 9 to 11. That's 2 hours. On day 2, same thing, 8 to 9, you are logging in. 9, start writing your examination. 11:30, you are done with general section. All right, so now what we're going to do is we're going to play a video for you to then see a live demo of how to log into the examination. As much as I've covered some of the things now when we were talking, let's have a video to see how you will set up your day of examination. After which we will continue with some of the things to look out for, the frequently asked questions, and then we'll go through the final Q&A.
Welcome to SAPC's step-by-step guide on how to log in to your examination. Ms. Lisbeth Kumede, Manager in the Pre-Registration Department, will guide you through the process.
When you book your examination, you are afforded the opportunity to choose whether you're going to write at your place of residence, you're going to write at a workplace, or you're going to write at any other venue that you deem comfortable and fit enough to meet the requirements of the examination. So the SAPC then uses a system called the proctoring system for them to then be able to invigilate you throughout your examination session. So when you're writing the examination, you then require 2 devices. 1, a laptop with enough network coverage to cover you throughout the examination, right? So your laptop must have a functioning webcam for us to be able to see you just the way that you are seeing me right now. So throughout your examination, SAPC is monitoring you from your webcam to be able to see what you are looking at and what your eyes are paying attention to. Second thing that you need functioning smartphone. Doesn't really matter the brand that you're using, as long as its cameras are working on the day of the exam. So before you sit for your exam, make sure that you have two devices, a laptop with a webcam, a smartphone with functioning camera, so that we're able to see you from the side. So while we are seeing you from the front, you using your webcam, we also need to see a side view using your smartphone. So the smartphone gives us access to see your workstation. We must be able to see what you do with your hands. We must also have a view of your surroundings throughout. Thirdly, is while we are writing, you are required to share the screen. So that means that we need to see what you are doing on the device itself. Whatever tabs we have open, SAPC needs to be able to see that. Because it's an open book exam, you can have actual paper, pen notes that you are using, and you can also have electronic copies that you are using. So while we are able to see what you have on the paper using the smartphone, we also need to share your screen so we're able to see what documents you have opened as you are progressing with the exam. So we are going to go through two steps right now. One is how to get through the exam, right, and what you need to do. Two is what SAPC is then able to see as you are writing the examination. I will keep my screen shared so that you are able to see and able to follow through what you need to do on the day of either the practice exam or the actual examination. So you will need to choose one of three browsers that you are comfortable with for the exam. Advice: have all three browsers downloaded prior to the exam. The browsers are Google Chrome, Firefox, or Microsoft Edge. Have all three downloaded, and then you'll be able to see which one you want to use on the day and which one you can revert back to should you need to. So for this demo, I will use Google Chrome because that's the one that I usually use. No specific preference whatsoever. I will now share my screen for you to then see what I am doing. So what you do then is we go to your preferred browser. Like I said, I'm going to go with Google Chrome, type in the SAPC website, all right? Then you go to the SAPC website. When you get here, it's the usual landing page. Please avoid going to click this red login button. Just go to registered persons. This will also be part of the email that will be sent to you just prior to writing the exam. You click on registered persons, says pharmacy student. You are a pharmacist intern. You click there, you get the overview, scope, internship, all of that. You go to pre-reg examinations. When you are here, it will say pre-registration examination. There's a link for you to click for the day of the examination. When you click on that link, it will then take you to the examination landing page where you'll be required to put in your PIN number, your ID number, and your password. Mine are already saved, which is something that I highly suggest because it makes things easy for you in the day of the examination. You will then go through a validation process, after which you will land on the OTP page. So the OTP is shared via both SMS and email. So whichever is easy for you to access in the day, you will go through that. It will say there that it will receive your OTP within 10 minutes, but usually you get this within a few minutes. So I have my phone next to me. It's going to be easier for me to go to my SMSs to quickly check. And yes, I've already received my SMS, right? So you can see I have my SMS already with me. I got my SMS just now. And then what I will quickly do is put it in, and my OTP is 52876, right? Click continue, and then it will take you through the steps that you need to follow. Right. The first one is it shows you that you must have proper lighting. Make sure that there are no other faces visible except for yourself. You will click next, and then it will start doing the system checks, right? So when it comes to the system checks, one, it will do a browser check. The browser check is to check that you're using a compatible browser. Remember, we said it's either Chrome, Firefox, or Microsoft Edge, right? It will do a webcam check. The webcam check is to check that your camera is on and not connected to anything else. So as you can see, my webcam check failed. Reason being, I am using it on the Teams to record this session, right? Then we'll do a microphone check to see if my microphone is open. Remember, during the examination, we must also be able to hear everything that is happening in the room. The next check will be your screen check to see that you have enabled sharing your screen. We need to be able to see everything that you're doing on the screen. Then you can do a network check to see if you are stable throughout your examination. So with the browser check, I've passed because I went to one of the three, which was Chrome, Edge, or Firefox. With the webcam check, I failed. The reason why I failed is because my webcam is currently used for a different platform and not the examination. So that means I need to go then to my Teams, right, and stop sharing my camera so that I can then go back and retry this check, since now my camera is no longer being utilized by Team and is now available for the system to use to proctor during the examination. We're going to go through the check and see now I'm great. My microphone is on. They are able to hear everything that I'm doing throughout the examination, so that passed. We are now on the screen check. With the screen check, I currently have my second screen connected, which is why we are able to see screen 2. When you have two screens opened like this, you are unable to share all of them at the same time. So you'll be asked to be forced to choose one. But remember that we say that we must be able to see everything that you're doing. So if you have two screens and you're only able to share one, that technically means that you're not able to see screen 2. Right? So if I choose the first screen, which is my busy screen, and I click share, I will definitely fail this check, because now there's a second screen that is not being shared and therefore not being monitored, meaning that I could do anything else on the other screen, which is not being part of the invigilation. So what I'll need to do is only one screen functioning throughout the examination. I will now click retry, and as you can see, my second screen is no longer connected. Therefore, I will try to share my entire screen and see if I am now able to pass through the checks. I've gone green. It's checking my network to see if currently I am stable. After I've passed that, it's also going to check my web RPC, and I've also passed that. Only then will I be able to click next. So if you fail your browser, your webcam, your browser can also fail if the version that you are using is old. So make sure that you monitor any other update that your laptop might want you to do prior to the examination. Your webcam, make sure you're familiar with your settings. Test your webcam. Actually go and find your camera from the laptop and try to take a picture just to make sure that it's functioning, right? Also your microphone. Just try, I don't know, call a friend via Teams via your microphone to make sure that it's working. Try have a Teams meeting to see if you're able to share. The thing is, we will send you a link. Right? We will send you a link with the proctor to test all of this. Make sure that you test so that you are able to identify any problem you might have prior to the examination. When we give you the link, it will perform all of these 6 checks on the device. Make sure that you follow it through so that you can make alternative plans on time. Now that I have all my greens, I'm going to then press next. Then it's going to show me my profile to verify that it's the right person taking the examination. I do update my correct information. I will then press next. Then it's going to ask me to take a photo. So when it comes to this photo, make sure that it is a shoulder width photo. So how I am currently appearing, right? So how I'm currently appearing is a bit of my shoulders are in the photo. My whole face is in the photo. I am not too close to the camera, right? And I'm not too far back. So just make sure that you position yourself very well. Also, my lighting is quite good, right? I don't have that blurring light over my head. It's not too dark. It's just good enough for me to then do what? Take a photo. So when you're here, you then decide on whatever pose you want to strike, right? Just make sure that we're able to identify you. So you stand here, shoulders into the frame a little bit, not too much, and then you take photo. All right. So as you can see, they are saying that there was too much going on when it comes to my photo. There was too many things. There's poor lighting. So now I need to reposition myself and click a retry. If it's saying that there's something wrong with your picture, just click retry and then see if you can reposition yourself and click take photo. Now the system is happy with the photo that I've taken, and only then will there be a next button. Now I will click next. Now it gives you a QR code. This is where your smartphone comes in. If different devices have the QR code scanner in different parts of the device, just make sure that you are familiar with where your QR code scanner is. And if it doesn't have a QR scanner, there are many apps that you can download that will allow you to scan your QR code. Mine came with the phone, so now I'm scanning the QR code. While you are scanning the QR code, your laptop will remain on this screen. And now focus on the video feed, so I can be able to show you what you are seeing. So as soon as you scan, you will see that on your phone, it will say there that you have scanned it, and then you will have to open the link. When I click open on the link, I'm just going to show you. It's going to ask me to then do a quick recording of my surrounding. When I press there, it's going to ask me to now start recording. I will then click on start recording. When I start recording, I then have to record my whole surrounding, right? So I will then just turn around so that there's a full feed showing exactly where I am. I am showing my entire office, right, to show that there is no one sitting with me in the office. I am all by myself, right? And as you can see there, you can see what the camera is showing. So it's connected with the back camera. Once I have taken a full video, I will then click stop recording. It will ask me to save the recording there at the bottom. I will then click save recording. It asks if I am sure that I want to save the recording. I will say yes. I am sure. It's giving me a preview of the recording, and then it saves the recording. So now it's asking me to please wait while it saves the recording. I am just now following all the instructions from the phone. It says that now the camera has been successfully connected. I can go back to the computer, right? So as you can see, everything that is appearing from my back camera is now available. So what that means then is I need to position the phone in such a way that I am visible. So then I need to find something to balance the phone so that as I'm working, they're able to see my hands and they're able to see what I am doing. Now that we have successfully connected our phone, and you can see there that you can see me from the phone and from the recording. I will now then close the camera from the laptop so that I can go back to sharing the screen, and you can now also then be able to see what we are now doing. When it wants me to verify this is me and this is the exam that I'm writing, I say yes, and then I click start. Once I click start, again, remember I must share my screen. It's asking me to choose what I want to share. I want to share my entire screen, and then I click share. Now we need to go through the declaration. But before we go through it, I want to give you some pointers. You can see here at the bottom of the screen, that's how the invigilator is seeing me. That's the front view camera from the webcam, right? And then my cell phone is on the side also monitoring me. My screen is being shared. So at this point, my invigilator is able to see 3 screens from my end. They're able to see that I'm currently doing my declaration, and that is the only tab open. They're also able to see my front view from the webcam, and they're also able to see me from the camera that I've pointed on the side. Now, I must read through all the declaration. When you get a declaration, all of them will be unticked. You must click, they will be unticked. Right, you will actually have to physically tick one of them. I've unticked 3 to show you something. When there's a declaration that is not ticked, you will not have a continue button. So what you will do is you will read through each declaration, right, and then you tick it to say that you will comply. So the first one says that you're writing the examination in a suitable area with minimum anticipated distraction. This is also important when you're choosing your venue. right? The second one says that you are writing the examination at the place that you chose during the booking. If the place that you chose during your booking changes, just let SAPC know that you're no longer going to be writing at home, you're not writing at work, or vice versa, or you're not coming to the SAPC office, so that we know where exactly you'll be writing the examination. Next one. I am not sitting next to anyone. So here you're confirming that you will not be getting any help from anyone, right? The ticket. You will not be receiving any assistance from anyone writing the exam and not sitting to any other intern. The ticket. You will not communicate, whether it's verbally, electronically, WhatsApp group, whatever it is, with either a tutor, pharmacist, any other person who can give any assistance during the examination. You will not use any other reference except for the ones printed for the exam. Remember, in the manual, we do list your exams in there. When you go to the website, we also list your preferred references there. And then also, we've already spoken about how Google can be used, but not as a reference during the examination. You will not give assistance to anyone. You will not be screen grabbing the questions during the examination or noting down the questions during the examination for you to share with anyone. And if you are aware of anyone who is recording the examination, screen grabbing, writing down, and distributing the examination, you will then share this with the SAPC. So now, once you have made sure that all of your declarations are ticked, you will then have a continue button at the end that will then allow you to continue with your examination. But then you click continue. Another note, make sure that your phone is on mute or on silence, because just like you saw with mine right now, I got distracted because it rang. And what did I do? I tried to move it to get it silent. When I did that, that means I interrupted my invigilation. So make sure that your phone is on mute so that you do not then get distracted during the examination and you are not then tempted to touch your phone and interrupt your invigilation. Now that you have landed here, you are now going to be given your instructions. And as you can see, it said that my mobile camera is disconnected. It got disconnected just by me trying to answer the call. So when you get any violation during the examination, all your violations are going to appear here. And how do I then reconnect my phone? I will click here, right? QR code. Rescan the QR code. Once I've rescanned the QR code, then my phone will be reconnected and that message will then disappear. While we are here, what we have options here is we have your calculator, we have your QR codes. If in case it gets disconnected, you have the chat function. With the chat function, this is where you are now able to chat to your invigilator regarding anything, right? So say I want to confirm what time my exam will be. I can say, hi, invigilator. What time the exam starts, right? And then I send it through. My invigilator will be able to receive this message and they'll be able to respond back to me. So now, here, while you're sitting here, you then get your instructions. With your instructions, you're being told how long the examination is, what you need to get to be able to pass, how the different sections are divided, what time it is for the different examinations. Again, you're able to go through the instructions just to make sure that you don't miss anything, right? And then you are landed and start the exam. So when you get to start the examinations are scheduled to start at 9. When you get here before 9, do not click the start the exam. If you do click start the exam, it will tell you that you are still waiting for the exam to be started. And then if you are clicking it after 9, you will go through the examination itself. Say you are landed here and you are going through the instructions, and 9 hit, and the exam becomes open for you to be able to access it. And a message will pop up that says that your examination is now open. You will click OK, and then you will click start the exam. If you attempt to access the exam before 8 a.m. in the morning, you will be put in the waiting lobby, right? So let's go through the times again. If you log in before 8 a.m., you will be put in the waiting lobby until 8. So 8 a.m. So if you try to log into the exam before 8 a.m., you'll be put in the waiting lobby, right? You need to wait until 8, and then you will be put into here where you can start when you are waiting to start the exam. If you are in here between 8 and 9, you will be waiting at this stage. You can read through the instructions, you can prep yourself, and if you get it after 9, you'll be able to click the start button and access the exam. So say I am here and it's after 9 and on the day of the examination and my exam is open, I will then click the start button, which will then take me to the actual examination, where I will now be able to see my questions and then go through everything that I need to do, right? So this is the first part, which is what you need to do as an intern. What I will then now do is give you a quick review of what we as the invigilators are able to see, so it's better understanding of what is expected of you on the day of the examination. So this is just so that you have caution of what we have opened on the day, right? So remember, when I log in, I am the intern, right? So I'm not sure if you're able to hear the echo that is currently going on. And that echo is simply because the invigilator is able to also hear what I am doing. So when the invigilator clicks on the current intern that is writing, which is now myself, remember, on this tab is me here on the exam, right? And then I'm in this tab here to show you how it looks like. So now my invigilator is able to see 3 screens. Remember I said this is my front view from the webcam, right? And then this is the side view from my cell phone. They are able to see my workstation, they are able to see my pen, my notepad, and they are able to see everything else that I am doing. That's the second screen. And then the third screen is they are able to see my workstation. So now what they are able to see is what I am doing on the laptop, because my screen is shared, right? Remember I said that means that they're able to see. So you can see from the screen share already, they can see that I have my proctor tab open, and they can see the second tab here at the corner, which is the examination. So if I were to open, for example, another tab, let's open another tab, and then we go to say YouTube for whatever reason. As long as I am on this tab, they will then be able to see. So as you can see, they were able to see that I was on YouTube briefly, right? And then when I close my YouTube, then you can see that also on the screen, the YouTube disappears. So you are allowed to go to different tabs. However, you must know that it will tell you that your focus has changed to a different window. This is fine if what you are doing is allowed, because you are aware that they are able to see what you're doing. However, this is also to notify your invigilator to say the intern is no longer on the exam page, they are looking at something else. Please go and have a look at what they are looking at to decide if it's something that they can look at or it's something that they shouldn't be looking at. Right? So this is just how your examination is going to be on the day and how you are going to be invigilated. We will now go back to the session for you to have any question that you might have answered. Thank you.
Welcome to.
All right, so now that we have gone through that video, I hope that that demo has given you a little bit of a feel of what you will see on the day. The currently displayed slide is just a clearer view of the declaration that you will have to do on the day. So the declarations are important because you are basically tying yourself to say that you will comply with the rules. Upon finishing the examination, you will again declare that you confirm that you stuck to the rules of the examination. While you are waiting for 9 to hit and start the examination, please make sure that you read the rules of the day and understand exactly what it is that you need to do. Should you have issues with the web RTC when you are getting there, right? We also give you instructions as to how to get over them. So when you hit each and every block of the system checks, it will also give you a brief description as to what you need to do. However, with the web RTC, it is the one that usually has issues if ever you have antiviruses that are blocking access. If ever your Wi-Fi has some firewalls that are blocking access, that's why we ask you to say, when we give you the link for you to test your systems, please make sure that you test the systems. The link is usually shared 3 to 5 days prior to the exam so that you have enough time for you to make a contingency plan should you need to. If you click the exam before 9 starts, it will say that examination hasn't started. If you're waiting on the waiting page until 9, you will get a notification that the examination has started. Another thing, make sure that the time is correct, that you're on South African time on the day of the exam, whether you're in the country or out of the country, but make sure that on the day of the exam, the time is adjusted to South African time. So whenever everybody else is saying it's 9 a.m., you must be also on 9 a.m. Otherwise, the exam will not continue. You will be getting notifications that you are being live proctored. And if you get a loading error, just make sure that you close absolutely everything. Go to your history, clear it, and come back and log back in. This is just a summary and not of all the violations that you will be getting as you are writing, but just to give you a hint to say, while you are writing as the candidate, you will also be getting notifications of the violations that you are committing as your invigilator gets them. So when it says that there's conversation in the background, please make sure there's no one with you. Sometimes whenever you're moving your papers, it can say that there's noise or conversation. We will just observe to see where the noise is coming from. If it's from papers, then you're good to go. But if it's conversation, then you will be asked to ask that person to leave. If you do not, you get cleared of the exam. If it says that your focus has shifted to a different window, it just means that you are looking at a different tab within your laptop. We will then look to see what you are doing. If you're in Google, going to a reference, that's fine. If you're Google typing in the question, you will be asked to stop. If you do not, you will be asked to leave the exam or rather kicked out of the exam. If you disconnect your mobile camera, meaning that we're not getting the side view, it will say that the mobile camera is no longer disconnected, and you will also be asked to please connect or leave the exam. If you connect a second screen, if your mic goes unmuted or you just lower the volume, all of those notifications will come through and will caution you. Only once. Second time, we kick you out of the exam. Just a summary, remember, 1 question per page. You can skip the question and answer it later, but if you answer it, you can't get back to it. Your questions are randomized. That means that when we are sitting together or when we are writing at the same time, no same intern gets the same question at the same time as the other one. You will all get the exact same 120 questions. However, they will come at different times. It is a timed examination. No time extensions will be allowed, right? So when the exam starts at 9, it starts at 9 for everyone. Or 11:30, it ends at 11 or 11:30 for anyone. Answered questions cannot be revisited. Unanswered questions will come back at the end of the examination. This is how it will look on the day. So you have your questions, you have your 4 options, you have the next question. Should you choose not to answer the question, if you select, then you will give you the next, you will then move on to the next question. You have references on top, which then you can open if you want to reference that we provide. Otherwise, you can access your own references. At the corner, there's chat with the invigilator. With the invigilator, you can chat to them about system issues, but you cannot ask them questions related questions, right? Once you are done, so as you are answering your question, each question that you answer automatically gets saved. So even if you lose network or connectivity or whatever as you go along, whatever you've answered has already been saved, right? However, when you are done, there is a submit examination at the end, and each question that you answer gets timestamped. Remember, only when you're not sure, skip it so you can revisit again at the end. Once you have now submitted your examination, we do require 6 to 8 weeks for us to do our moderation for the exam to ensure fairness and that all questions were marked correctly, and then your examination results will be released. When they are released, you will go to your secure site, log in, go to pre-reg examination. Next to the examination booking that you used when you're booking will be examination results. When you click there, you will then be able to view your results. With the practice examination, you get to see the actual questions and the memo, but with the actual examination, you do not have access to the actual memo, only how you did with certain domains. If you want to review your examination, you are more than welcome to book and come to the SAPC offices. However, we do not do a remarking because in the 6 to 8 weeks that it takes for us to release the exams, we are making sure that all procedure was followed. So there is no need for us to then do a remarking. However, we can provide you with the review for you to have an audit trail and see the memo and see the references that were used per question. If you meet the sub minimum for one, right, and exceed it, but not meet the sub minimum of the other, you will then be deemed unsuccessful for the whole paper. And when you have to rewrite, you rewrite both sections, regardless of how well you did on the other sections. Because like we said, it is at the end of the day, one paper just split into 2 sections. So between the 8 and 9 a.m. hour, remember we said that you need to be in contact with your invigilators. You can reach out to them, they can reach out to you. However, we strongly advise that if you are struggling, please reach out to your invigilators. You can either text the WhatsApp number that will be shared to you, you can call center, or you can use the chat functions for you to then get assistance. But whatever you do, do not struggle in silence. Please make sure that you reach out to SAPC so that we can take you through the process. Should you struggle, please also rewatch the video a day or two before the examination so you are better prepared for the exam. Let's look at some frequently asked questions. Help during the examination, chat function. The invigilator will respond to your chat. We will give you a WhatsApp number that you can use on the day. You can call directly customer care, and you can also make sure that you reach to whoever that you have an email address to SAPC. We will be responding to you and providing assistance where we can. Where should you sit? We said anywhere of the 4 venues. Just make sure there's sufficient lighting, not disruption that you can anticipate. Your camera is functioning. Everything that you saw gets recorded and kept. So please try and dress as appropriately as you can. Yes, you are writing at the comfort of your own home, but remember, we are recording this and we get to keep this for a while. What should you experience? What do you do in case of load shedding? If you lose connectivity or power during the exam, what you have answered is already saved. The issue is what was not answered. You would have to try and move and get to another place as quickly as possible. But a tip here, make sure that you are aware of your load shedding schedule, that you are prepared for any backup. Make sure that your phone has enough data for you to use it as a backup should you need to be, just so that you know that you are able to continue. Make sure that your laptop is fully charged so that you can at least rely on the battery life of the laptop as you are continuing. The first 2 attempts of the exam are free. The 3rd exam, that is the actual exam. All practice exams are free. You can do that as many times as you want. However, the actual exam, 2 tries are free. The 3rd one comes at a cost. If ever your QR code gets disconnected, that is your phone, you will click at the bottom where your face is appearing, where my face is appearing. When you click there, you will see that you have access to a calculator on the platform for you to calculate. The second one is a QR code for you to rescan and reconnect. And then you also have the chat function for you to be able to talk to us and a back button. If ever you lose connectivity and you're coming back, it's giving you options that says maybe that this page was opened elsewhere. That could mean that the previous session was not properly closed. You need to close everything. And every time we ask that you close all your browsers and log in again, sometimes we struggle because of the fears. People are afraid that they're going to lose their answers. But the longer you take to follow the instructions from the invigilator, the longer it takes for you to get back into the exam and the more time you lose. So when you call in or when you're texting and the invigilator says, please close all browsers, close all tabs, close everything, try to follow those instructions as promptly as you can so that you both save on time. Because if the invigilator tells you something and you do something else, that now bites on your time, right? And we included a few steps on how to clear the cache on the different browsers. I will not be going through these ones. You can review them at a later stage or practice on your own laptop to know how to clear your history, how to clear the cache on all the 3 browser so that you are ready on the day. If you booked to write at the SAPC, but now due to whatever reasons you want to write at home or vice versa, please pop us an email on pre-registration exam workshops at sapc.za.org, just so that we have a record of where you are supposed to be writing on the day, and we're able to allocate you to the correct venue so that you get prompt assistance on the day of the examination. And if you have any other query relating to this workshop or the exam, please send an email to that email address so that we are able to assist you. On the day, you can also send an email there, but preferably please try speaking to your invigilator or using the WhatsApp. It's going to be quicker for you to get a response. Right. Remember, for your examination, for your internship rather, you are evaluated on 4 things. The exam that you're going to write, which is proctored and you need to pass, your portfolio of evidence, all 6 of them, your positive progress reports from your tutor, and being an intern for more than 365 days. None of those 4 is superior to the other. You have to meet all 4 requirements for you to be released from internship. We have already spoken about this in the CPD workshops earlier, to say that please make sure that you meet the requirements of your internship. Internship is basically you doing your practical learning component of the BPharm degree. It is not necessarily, yes, you are employed, yes, you are getting a remuneration. However, it is just the last step of you becoming a pharmacist. Please take it as seriously as you did your academic journey, and let's try focus on making sure that we meet the requirements within the 365 days so that we're able to open up the posts for the next upcoming interns. Let's try to avoid moving pharmacists, as that also creates a problem for you, because now you must do a session of contract, which then may also delay how quickly you finish your internship. Remember, you do have 2 scopes of practices. That information is available on the website, but please make sure that you understand what the 2 scopes mean and how you can apply them, right? And also there, it is also listed as to what you would need to do if you wanted to access the 2nd scope of practice. And then now we are looking a little bit onto what then happens once you've met all 4 requirements of internship, and now you are moving on to be a pharmacist, which is at the end of the year. This is just to emphasize that the SAPC does the registration as a ComServe, but we don't really do much as far as the application for being a ComServe. That is now done via DOH, right? We have sort of reached the end of the presentation. Let's now do a bit of the Q&A just to see what new questions came. Most of the questions were attended to on the Q&A as we were going along, but let's just see what else might have came while we were doing the presentation that needs attending to. If you still have any questions, please do ask. I will then read through what we have. The next question that we have is asking, are we allowed to use the Medicines and Related Substances Act with the regulations associated with it during the examination for the scheduling? Yes. Any reference that you deem fit, you can use. The only thing that we don't allow is you going straight to Google and typing a question for it to assist you. Right. The next question is, if there is a connection problem and we have to log in again, do we still have to do all the equipment checks? No. So what we have done now is to save on time. It will not, like if you saw with mine already, the declaration was already ticked. That's because I was already assessing the exam before. But if you had logged in, was successfully writing, get kicked off. When you re-log in, it will only ask you to wait for the OTP. After the OTP, it will take you straight to the questions. You will not have to do the system checks again. Next question, are we allowed to use our university lecture slide saved on a folder on our laptops? Yes, you are. Next question, are we allowed to use the find on page options when searching in a document, or must we physically scroll through? Yes, you can use Control F or find for you to go through your references quicker. As long as the reference is in the laptop, that screen is shared and we're able to see what you are doing. All right. I believe we have gone through all the questions, and it is now exactly 12 on the dot. If we do not have any other questions, I please ask that you go through and submit the survey. Both the interns, if they could please submit their survey feedback so that we know what we can improve for future. And if we have any tutors or any head of pharmaceutical services joining us, if they could also fill in, or responsible pharmacists also fill in the survey so that we have feedback on what we may need to improve for the next sessions. All right. And then the next question while we are doing the survey is, how do we access the presentation slides? So if you go to the SAPC website, right? If you go to the SAPC website and you go to registered persons without logging in, just type SAPC website, you go in there. When you enter the website, you go to registered persons, pharmacist intern, pre-registration examination, where you are supposed to be accessing the examination. That entire page has all the information you might need relating to the examination. It has past papers that you can print and try out, which is different questions from the questions that you're going to experience on the day of the practice examination. It has previous presentation, like a 2025 presentation, as this presentation will only be made available on the website after the study presentation. So right now already you can have the manual, past papers, and previous presentations on the SAPC website for you to look at. That is the last question that I have. We have already attached links to the surveys for you to have a look at. An announcement. Remember, this year we have our 4th National Pharmacy Conference taking place on the 13th to the 30th, on the 11th to the 13th of October 2026 in the Inkosi Albert Lutuli, also known as Devon ICC. Please make sure that you register and attend. It's a great networking opportunities with leaders in the field, and a great way for you to also get yourself out there. If you are studying and have an abstract that you'd like to present either orally or via a poster, please also make sure that you are submitting so that you are able to showcase your work. If you want to get constant information on what is happening, the SAPC Council has a WhatsApp channel. Please scan the QR code so that you are then able to follow us on WhatsApp and get latest updates that we have. Again, are there any other questions? Or are we good? All right, I will leave it at the email address if you do remember any questions that you might have. Otherwise, thank you very much for your time. We do hope that the presentation was helpful and that you will do your absolute best for the examination, all the best for the internship assessment, and we hope to see you soon. Enjoy your day further, colleagues. Bye.